From waiting lists to waiting on trolleys, the Irish healthcare system is rarely out of the news. While progress is gradually being made in areas such as the development of a new consultant contract and access to additional capacity to address waiting lists, what new advancements, particularly in technology, should we be focusing on to make our healthcare service more efficient and patient-centric? Joining me now are Miin Alikhan, Assistant National Director in the Healthcare Strategy Division of the HSE, and David Wall, Chief Information Officer at Tallaght University Hospital, to discuss key insights from the International ViVE Conference and the lessons we can learn to shape the future of Irish healthcare. You're both very welcome.
Thank you, Gary.
Thank you, Gary. Glad to be here.
Miin, I might turn to you first, and I guess
Sure.
we're very fortunate that you've got a lot of experience working outside the Irish healthcare system, and you've probably experienced many of the challenges and opportunities that we face as well. Could you share some of those with us and some of your perspectives on what are the opportunities for the Irish system?
Sure thing, Gary. I guess two major key takeaways is that the first is that healthcare systems across the world, I believe today, are facing the same significant fundamental challenges, regardless of geographies. We've got issues with regards to core workforce recruitment and talent management, issues around true implementation of outcomes-focused integration of health and social care. Thirdly, that our quality outcomes don't seem to be keeping pace with the upward trend of investments and technological and medical advances. And fourthly, and perhaps most importantly, we're all challenged with getting it right up front in terms of the design of incentives and reforms that reinforce that healthcare is value and a public good versus a cost and reactive service. But having said that, despite these challenges, I believe there's a lot of reasons for optimism, many of which you can see demonstrations of already within the Irish healthcare system. There's definitely shifts to more care at home initiatives, to non-conventional partnerships, which are a fundamental lever to addressing some of our really great challenges. And thirdly, a shift towards more open systems of data sharing. And all of this driven by more of a population health approach, by an understanding of factors or variables outside of just the healthcare system. So looking at the wider social determinants of health, prevention, and more upstream interventions. And thirdly, a shift driven by greater thinking around reimbursement for quality and outcomes versus quantity and transactions.
Yeah, thanks very much, Miin. And Dave, I suppose turning to you, Miin mentioned there a couple of things like the way we change care and the way care is provided. I guess you're working at the front line in Tallaght, and it seems that overcrowding in the healthcare system is almost a year-long challenge now. Reflecting on Miin's comments and what you heard at the conference and the site visits, do you see some opportunities, maybe to use technology to help address that? And what are the things that you're looking at in your role?
Absolutely. I suppose the hospital overcrowding is a very complex situation and very challenging. And I think it's important to put it in the correct context. And part of that is getting all the information. So analytics is a very important part to play in this, because once we have access to the information and we understand where the problem is and why so many patients are presenting at hospitals. So if you take, the first part in the patient journey is the GP. Do we understand what our GP capacity is now and in the future? Do we understand the GP availability, the availability of slots, patients, demographics and attending? What hours are we providing that service? Is that meeting the demand? Because the workforce has changed, people have changed. The traditional kind of 9-to-5 model of providing services is very different now. So we need to understand, the information there to then, I suppose, provide the service in the most appropriate, efficient manner. And are we actually providing that service in an efficient manner? Is there a better way that we can provide that service? Then if you take the acute sector, when I suppose part of that journey, when the patient does present to the hospital. Absolutely, within hospitals, you need to have your emergency department systems. You need to have your electronic patient record systems. But there are other solutions as well that will complement that really well. And two of the ones that really stood out at the conference was really around patient flow management and unified communications. So the examples we would have seen is, the patient was left the ED after successful treatment. Immediately after they left the cubicle, the cleaning staff were notified, and I think we observed within 1 minute, the cleaner arriving to clean the cubicle. Then once the cubicle was ready, the ED staff were told that it was now available. The patient is then seen. Then you take that kind of patient flow management to your whole hospital. So that then having that whole hospital view of your beds, your bed management, which beds are available, which beds are closed, but also then you weave in your workforce automation. So then instead of having to ring the cleaner or ring the porter or ring radiology, it's all then supplemented with a unified communications system. So that's where you're now taking 2 or 3 or 4 different complementary technologies and interweaving them together. And that then creates your workforce efficiency. So now we're bringing in transformation, and I think one of the key themes that we seen at the conference was this whole challenge, and Miin referenced it there earlier, about the workforce. So it's not just about attracting and retaining staff; it's how you do more with what you have. And I think one of the other themes that we observed as well was this concept of multitask assistants now, that and not just multitask assistant, but the traditional nurse or traditional physios are doing other tasks that complement the role that they're able to do as well, because digital technology solutions have now given them the capacity to, it's one of the things we look at very much in Tallaght, and we call it releasing time to care. So we did a project, as I say, around single sign-on. So that's allowing people to log on with your ID card to your PC. Now, because of the variety of these systems and usernames and passwords, it can take some time for that. And in the study we did, we found that saved the average nurse 59 minutes per day. Now, if you extrapolate that out across the entire health service, you can see the efficiency saving. And what that does is give releasing time to care. You then add something like your patient flow system now, where you're now getting that real-time information on the analytics, on the movement. You're not making the phone calls. You're not having to chase up people. And then your unified communications, and you then say add in your nurse call alerts. So when you take all those kind of things, that then speeds up your whole flow of patients through the hospital, your access to your diagnostics, etc. Then once they're discharged, I suppose the next stage in the journey then is looking at, are they discharged home? Can you discharge them home now for the likes of remote monitoring or remote care? Can you discharge them to a step-down facility but still monitor them remotely? So I think I recall one of the terms or phrases that was discussed at the conference was using your bricks and mortar more efficiently. And that really stood out and resonated with me. Patients need to be in the right place at the right time for the right care. So they don't always need to stay. So yes, they come for their acute care, then they leave the hospital and they go to the appropriate setting, but you're also then monitoring them in that appropriate setting. So you're getting that whole circle of care.
Yeah, really interesting, Dave. And I think one of the things you mentioned there, and it was a key topic at the conference as well, Miin, I might come to you on this, is that access to care and health equity. And I wonder, have you had a chance maybe, Miin, to reflect on how important is that in Ireland? Do we give it enough consideration, and maybe bring in some of your experience from other jurisdictions? Is that something you see as an opportunity for us and something we should focus on?
Absolutely, Gary. And let me start off by first saying that I believe, and it really came through at the conference as well, that health equity is core and fundamental to the quadruple aim concept within healthcare. So quadruple aim, reflective of the patient or service user experience, staff experience, clinical effectiveness, and value as defined by quality over cost. Health equity is fundamentally part of the patient or service user experience. It's not an additive or an additional dimension. So that's, I think, the first point. The second point is, kind of reflecting. Now, I don't have the firsthand experience as you and Dave would have had through COVID in Ireland, but certainly in Canada, where I hail from, the pandemic really shone a big spotlight on the cracks within our system in terms of one's experience, in terms of access through that time. And it really, I think, was a wake-up call for those in healthcare that we must ensure that fundamentals are embedded within our system, that also ensures that people going through our system, regardless of their socioeconomic status, their demographic status, and certainly geography, that they're experiencing the same high standards of quality of care that we provide. So I think it's just fundamental, regardless of geography, that we think about health equity as fundamental. In terms of access to care, how David just described it, fundamentally, access issues are really at points of transitions in care and handoffs, whether it's receiving that individual at the front door of an organization, between intra-organizational services, as David had just mentioned, or discharge to subacute community settings and back to home. I think that given that those fundamental root causes, it really means that we need to be understanding for the solutions precisely what's happening at those handoff points, and really understanding kind of the steps in the process, but also kind of is our patients experiencing access differently based on what specific cohorts they're in. Is leadership and governance and accountability designed intentionally to ensure shared ownership for the patient experience across the system of care? Just a couple of points from, my past experience earlier on in my career, when I talk about, steps at handoffs, and does it truly add value to the patient experience? I remember sitting in a room with about 60 individuals from different parts of an academic hospital, and process mapping the number of steps required from decision to it, or from triage to decision to admit, 119 steps. And only 10% of those actually touched upon or involved a direct patient exchange. So it goes to show you kind of the improvement opportunities as what Dave was talking about. I think in terms of going back to patient experience, we need to be thinking and designing specific interventions, especially when it comes to partnership lines, as for individuals who perhaps are more vulnerable or experiencing more complex social situations that require greater transitional wraparound services more appropriately provided in the community, that span the boundaries of housing, labor, healthcare, mental health and addiction supports, and other kind of more social care services. So those are just a few of my thoughts. It's these types of interventions that will ultimately affect diversion from our emergency departments, reduce hospital lengths of stay, and ultimately improve access along the continuum of care.
Yeah, I might just come in there. I mean, like the whole team, I think, of preventative health really came through. Yeah. And I think that's one of the things Miin is referring to there, about how can we keep people healthier so they're not getting, with I suppose, what we observed at the conference and the presentation around the socioeconomic divide, and we do experience some of that here in Ireland, unfortunately. It's really about, there was a very interesting presentation, I think, on eating that we attend, and diet. And so it was all about food healthiness. So the whole area of healthy preventative measures, so people aren't getting sick. And if they're getting sick, they're not getting too sick, if you understand what I mean. That is either manageable in a community or GP setting, as opposed to then having to go to an acute setting. So absolutely, again, that's where, we've seen a lot of presentations around the use of wearables, and sensor technology, and how organizations how insurance companies are partnering with those organizations now and giving incentives in your healthcare plan around that, so that if you've got a good diet, you've got this, that you should stay healthier. So again, I think that would be one of the huge learnings for Ireland from that is our approach to preventative health.
Yeah. And I think what's really heartening, though, is we have a lot of those already, established in Ireland or on their way of being established through our Sláintecare Healthy Communities initiative, through our social prescribing initiatives, through, I think, really creative ways of partnering across different organizations through a multidisciplinary lens. Just most recently, I had the privilege of visiting with the Acute Medicine Assessment Unit team at St. Luke's in Kilkenny, and then Piedmont Healthcare. And I just was really impressed and heartened by some of the broader upstream as well as downstream initiatives that the teams there are looking at, both for primary prevention, but also secondary prevention.
I think that's really interesting. And Dave, maybe to come back to you, I think one of the key things that struck me from that conversation we're having there is just the wide variety of stakeholders and people who are involved in the whole healthcare system. I guess that shows how complex it is. But I suppose it also points to the need for data and information to flow and be able to be shared with the right people. You've probably experienced some of that from your work in Tallaght, and I suppose you're probably seeing other opportunities where we can even do that better, and some of the things we should look out for.
Yeah, having that ecosystem and that partnership across all partners is really important. And obviously the patient has to be at the centre first and foremost. But then you've got your industry partners, you've got your insurance partners, you have got obviously your healthcare partners, but you've also got your academic partners as well. So, having those partnerships and relationships and leveraging those relationships in the most appropriate way as well. For example, we've referenced there about how insurance companies are partnering with Fitbit and other sensor companies and Apple as stuff to offer incentives around your insurance plan. But then also you can look at, well, what else we do out, there's a certain amount of outsourcing done in the Irish healthcare service where the capacity exists in the private sector. But, there's opportunity to go beyond that. You've got initiatives now where, private companies are looking at, well, can we handle the step down care? And there is some of that being done now, that once the patient is discharged from the acute setting, we can plan out that care pathway and they can manage that care pathway for the patient. So again, it's about everybody working together. And I suppose where the digital comes into that, there's a myriad of digital solutions, but you mentioned absolutely, business intelligence analytics is key to that. The IHI is another key piece, and it's great to see the work that Maria McCann and her team are doing in the HSE around the introduction of the IHI and seeding that. So we're able, to connect the dots and connect the information around the patient, but also more importantly, identify that this is the correct patient so nothing falls through the cracks. Other initiatives then range from, you've got Tallaght runs a very, very good Healthy XWell program where we run these fitness classes and stuff post discharge for some of our patients. So I think what we have to do is leverage that ecosystem. Now that then goes beyond that. If you take it to the next level, and this is where we need to be planning 5, 10, 15 years down the line. Are we embedding, digital within our curriculum for all of our healthcare employees? So back at college level, e-health, digital should be part of the curriculum now, as should innovation, process. We talked about change and transformation. These are all really important skills now that need to form part of whether you're a physio, whether you're a doctor, whether you're a nurse, or whether you're a social worker, because the environment you're coming into now is a very different one from 5, 10, 15, 20 years ago. And digital now underpins everything we do. And then people once they're using technologies, have to understand what to do with the data. So we have to start now speaking data. And these are skills and knowledge that we need to give our healthcare workforce. So that's that. Then, as I say, on the academic, so that's when you're training your staff. But likewise, on the other side, then when you want to do your research and your audit, that's another key partnership for audit where, to reference back to Miin's point about improving patient outcomes, that only comes by doing clinical audit, by doing research, by doing our clinical trials. So all of that is underpinned by technology. So that's your ecosystem. Then you've got your link with your industry partners where they're coming up with the new technologies, the new solutions to treat different conditions, and also improve turnaround times or whatever it may be. So I think it's really important that we have this ecosystem. And Ireland is very fortunate. Ireland is one of the top med tech countries in the world, and we have so many companies here. Unfortunately, most of them seem to be doing business outside of Ireland, and I suppose that would segue into innovation. We need to create a culture of innovation in our hospitals. There's also a pathway. There's lots of really good startup companies out there, but it can be quite complex and very onerous, to get into healthcare and also get in front of the people because of the requirements, be it procurement requirements, be it insurance requirements. So I think it's really important, that we cultivate this. And an example of that is the good work that's being done in the Guinness Enterprise Centre. I can't remember. There's something like 20, 30, maybe 40 health startups alone there now. So I think it's really important that this ecosystem, that industry, academia, healthcare, and a patient and all our community acute, we all work together for the good of the patient.
Yeah. Could I perhaps add to that? Because I think I completely agree with what Dave was saying about the need for partnerships that perhaps are often seen as non-conventional, as particularly across public services, industry, and academia, so that we can foster a culture where there's greater rapid translation of evidence and research into actions and implementation plans. But perhaps two additional points to make. One, that partnership, really, we need to focus as well very much, and Dave already touched upon that, in terms of involving our patients, our service users and caregivers in a much more meaningful manner in both program planning as well as evaluation and research. And to do so, we must commit as well to providing the necessary human and technological support to enable patients and their caregivers to be true partners. Back to the concept of equity, I think built up front, it's very exciting to hear about all the technological advances, but to also ensure that we're intentionally mitigating against the potential for creating a greater gap in terms of digital health access and literacy at the same time.
Well, I think that's really fascinating. I think that conversation has really shown so many opportunities and so many nuggets of advice, I think, as part of that. Maybe just to wrap up, we might come to each of you. Maybe, Miin, I'll start with you. If there was 2 or 3 pieces of advice you'd give to healthcare leadership in Ireland, what would that be? And Dave, will come to you then afterwards, maybe on the same question. So, Miin.
So perhaps I'll think about, I'll reflect on 3. One, and this really came through the conference, but the time for incrementalism is long gone. We need bold and courageous leadership, but at the same time, bold and courageous leadership that's very thoughtful about upfront design of reforms and incentives that allow for measurable impact without unintended consequences. So that's 1. 2, the only way we're going to make improvements is to embrace new ways of working based on new ideas. And the only way to create those new ideas or to stimulate new ideas is for leaders to enable an environment that harnesses the ingenuity, creativity, expertise of our people, and create environments where it's just easier for people to do the right thing and to remove barriers for them. And then lastly, I would suggest we avoid normalizing any deviance that it's okay to be mediocre. Because at the end of the day, our service users, their caregivers, our teams deserve nothing less than excellence. And so we need to be constantly challenging ourselves towards nothing less.
Oh, really good. Dave, what's a piece of advice you have?
I suppose I haven't been to the conference now. I actually felt like very reassured. And by that I mean is, it's quite often referenced that the US's healthcare system is ahead of us. And I think the statistic thrown out was 90% of US healthcare now is now digitized. I felt reassured in that Ireland is on the right path. It can learn the lessons. I think there was a lot of lessons that we can learn from what has been done in the US and in other jurisdictions as well around that. So that actually filled me with confidence. Secondly, I suppose what struck me as well is they're realizing now how complexity. So I think the second thing is we and you touched on this earlier, is we need to standardize. We need to strip out that complexity, because that was one of the things I think the US is now struggling with is this interoperability and how they're going to share this information between all the different caregivers, the providers, the insurers, the healthcare agencies, the practitioners, whoever it may be. So I think we have an opportunity here as well to do a lot of the groundwork we need to do now around standardizing our care pathways, standardizing our protocols, standardizing our documentation, standardizing how we treat people, how we train our staff. So that was really important. Thirdly, I suppose, is looking at the variety of digital solutions now, there isn't a one size fits all. And I think it's really important that we realize that not everybody needs an EPR immediately. Some do, some don't, but there's lots of other solutions like patient flow, like single sign-on, like electronic vital signs, like lots of other good, like virtual monitoring, and fourth, I think we need to realize we're in a very, and again, you touched on changing environment. Healthcare workers need to become more adaptive. The standard role that you may have done in the past, it needs to change, and people need to be more open and more flexible to different ways of working, to different ways of engaging with patients. Because again, if we look at our demographic, healthcare deals with people from 0 to typically 110 years old. That's very wide. But patient engagement now, and now you've got a generation of people who grew up with technology. So they engage with their retail, they engage with their airline, they engage with their shopping in a digital manner, and they expect that from healthcare. So I think we need to realize that, and that allied to what Miin was talking about, our staff, involving them, involving the patients. So I was reassured that we're on the right path. There's valuable lessons that we can learn that can make our journey, a lot smoother.
Yeah, thank you very much. That was really interesting, fascinating to hear from both of you. And some really great insights there. And to learn more about transformation in health, you can go to ey.com. Thank you so much for joining us today.